For millions, antidepressants are a lifeline, lifting the fog of depression and helping people reclaim their lives. The conversation usually starts with hope, how these pills can help, their benefits, and possible side effects. But what's often missing is a frank discussion about what happens when it's time to stop. Many expect a smooth transition, but for a large number, withdrawal is anything but easy. Instead of a simple return to normal, people can experience a wave of distressing symptoms, physical illness, emotional swings, and mental confusion. This isn't a relapse, it's withdrawal, known as antidepressant discontinuation syndrome. The silence around this issue leaves many feeling isolated and unprepared. We'll pull back the curtain on what really happens after quitting antidepressants. We'll explore the science, the symptoms, and hear from those who've navigated this journey. The goal isn't to scare, but to empower, with knowledge and transparency for every step of the mental health journey. Because getting off the medication should be as carefully managed as starting it. Let's talk about what happens when the pills stop. To understand withdrawal, we need to know how antidepressants work in the brain. These drugs, especially SSRIs like Prozac and Zoloft, increase serotonin levels by blocking its reuptake. Over time, the brain adapts, reducing its own sensitivity to serotonin. This isn't addiction, but it is physical dependence. The brain's chemistry has changed. Suddenly stopping the medication removes the support the brain has come to rely on. The result? A sudden chemical imbalance, triggering withdrawal symptoms. The brain needs time to readjust and restore its natural balance. That's why quitting cold turkey can be so disruptive. The journey back to equilibrium is rarely smooth. Understanding this adaptation is key to managing withdrawal. Withdrawal can unleash a range of symptoms, some bizarre, some debilitating. Brain zaps, brief, shock-like sensations, are a hallmark, leaving people disoriented. Physical symptoms mimic the flu, dizziness, nausea, fatigue, and insomnia. These aren't minor annoyances, they can disrupt daily life. Psychologically, mood swings, anxiety, and emotional numbness can be overwhelming. Many fear their depression is returning, but these are withdrawal effects, not relapse. Research shows over half of those who stop antidepressants experience withdrawal, and nearly half of those cases are severe. Yet, this reality is rarely discussed at the start of treatment. Many turn to online forums for answers, seeking validation that what they're experiencing is real. Withdrawal is common, not rare. Knowing what to expect can make all the difference. The best way to minimize withdrawal? Tapering, reducing the dose slowly over weeks or months. Think of it like a diver surfacing gradually to avoid the bends. Your brain needs time to adapt. Experts now recommend hyperbolic tapering, smaller reductions as the dose gets lower, because even tiny amounts can have big effects. Unfortunately, not all doctors are aware of this, and some still suggest rapid tapers that can trigger severe symptoms. Real stories highlight the risks. People left bedridden or in crisis after following fast tapering advice. Many find support and better guidance in online communities, sometimes creating their own tapering schedules. The role of pharmaceutical companies in downplaying withdrawal risks has contributed to this information gap. Antidepressants aren't addictive like opioids, but physical dependence is real. Greater transparency and better education are needed for both doctors and patients. Informed consent means knowing the risks and the safest way off. Tapering isn't just safer, it's essential. Slow and steady truly wins the race. If you're considering stopping antidepressants, don't do it alone. Find a doctor who listens, understands withdrawal, and supports a slow taper. Track your symptoms and be patient. This is a marathon, not a sprint. Build a support system. Let friends and family know and connect with others who've been through it. The medical community and pharmaceutical industry must do better. Clearer information, better training, and honest conversations are essential. Patients deserve the full picture from start to finish. This isn't about fear, it's about respect and autonomy. If you're struggling, know you're not alone. The brain can heal, and the storm will pass. Share your story. Together we can break the silence and push for change. Every mental health journey deserves support, transparency, and hope. Let's make sure no one faces withdrawal in the dark.